Thank you, Mr Davis, and it's a pleasure to serve under your chairmanship. And can I start by thanking my friend, the Honourable Member for Islington, for bringing this important debate and for being such a consistent champion on this issue. We've heard some excellent contributions this morning, Mr Chairman, and I want to pay tribute to the members, to all members who've spoken this morning, but the members for Bedford, Strangford, Westland and Lonsdale for raising the issues around investment, workforce and the bureaucracy that surrounds radiotherapy. And also, I just want to pay tribute to the contributions from members from Rhondda and Islington, also again for who speak with authority on this issue as a result of their experience. Mr Chairman, this morning we've heard that radiotherapy is a vital tool in a fight against cancer, and that it is one of the 3 pillars of treatment alongside surgery and chemotherapy. That radiotherapy is needed in by 1 in 4 of us across a lifetime should be a stark reminder of just how important today's debate is. And I want to join the member for Islington in paying tribute to the work of charities like Radiotherapy UK and the Catch Up with Cancer campaign who for keeping this important issue on the agenda. Mr Davis, with members across the House and members here will know the impact the pandemic has had on cancer treatments and the devastating backlog that it has caused. In my own constituency of Enfield North, data from Macmillan shows that 73 people are missing a cancer diagnosis and a further 57 are waiting for their first cancer treatment. This backlog in treatment, coupled with the severe workforce crisis, which has been highlighted by every member this morning, which is rapidly stretching across our health service, means we are facing a situation whereby the outcomes of cancer patients are being put at risk. Radiotherapy, as we've heard, is a vital tool in our fight against cancer and should play a key part in our work to help overcome the backlog that is affecting both patients and staff. As highlighted, as I said, by all members this morning, with the pandemic impacting so much of the NHS operations, radiotherapy provides a COVID-resilient form of cancer treatment by not having an impact on the immune system or needing admission into intensive care. It is also very cost-effective, as mentioned by the Honourable Member for Islington, with the average cost of radiotherapy ranging from £4,000 to £7,000, making it cheaper than the often costly options of surgery or chemotherapy. Despite this, radiotherapy has been consistently overlooked when it comes to policy, meaning it has often faced a lack of both investment and understanding by policymakers and governments, successive governments. And as we've heard today, in the UK, just 5% of the budget for cancer is spent on radiotherapy. This means that despite significant global advancements in radiotherapy technologies, patients in the UK are continuing to miss out. Half of all NHS trusts are using machines older than the recommended 10-year lifespan, giving patients... Yes, of course.
I'm very honest. I do apologise for breaking the flow of my honourable friend. These are important statistics, but I think one that's worth remembering is that in over 50% of cancers, radiotherapy or precision radiotherapy would be effective as part of a treatment, perhaps not exclusively. Actually, when I had my treatment, I had everything. I had surgery, chemotherapy and radiotherapy. But it would be effective in over 50% of cases. It's currently only given to 27%. So even before we start tackling the backlog, there's a huge capacity issue. And I do hope that my honourable friend recognises that and the Minister will address it.
I'll thank my honourable friend for that intervention. I absolutely agree with him on that point. As was mentioned by many of the members, many patients don't even have the luxury of being treated by really old technology. As we know, more than 3.5 million people in the UK are not having radiotherapy centres within the recommended 45 minutes of their home, as it was mentioned by the member for Bedford and everyone else. This has led to a situation where, rather than international guidance of 57 to 60%, just as the member mentioned, just 27% of cancer patients in the UK are given radiotherapy. Patients are receiving a raw deal at every turn in the UK, putting their treatment and their long-term outcome at risk. However, it is not just patients who are feeling this strain. As we've heard, radiotherapy staff, like many of their colleagues across the NHS, are feeling undervalued and under-resourced. A workforce survey carried out by Radiotherapy UK, as it was referred to earlier, showed that 80% of radiotherapy staff were or knew of someone considering leaving the profession. 90% felt that the government did not recognise the significant role radiotherapy has to play in reducing the cancer backlog, and 75% felt that they did not have the capacity to reach a pre-pandemic service level. So a plan to improve provision of radiotherapy or any other treatment across the NHS will not be successful without a robust workforce strategy behind it. Absolutely. So I asked the Minister this morning, and other honourable members have raised it as well. How do the government expect to tackle the cancer backlog when staff feel like no one is listening to them? NHS staff have made immense sacrifices during this pandemic and deserve to be heard and respected, not have their concerns ignored. For the staff that remain in radiotherapy, they're met with barrier after barrier when it comes to improving the experience of patients and effectiveness of the treatment. As I said, I do run the risk of repeating these points, but these are key issues and need to be repeated in order to justify investment to fund a new and updated machine. NHS trusts are required to be conducting 9,000 treatments per year. So during the pandemic, where we have seen referrals plummet and services stretch to breaking point, this is a target that is plainly and unrealistic for many trusts to meet. This leaves staff with faulty, unreliable equipment which frequently breaks down, and patients with delay, postponements, cancellations, and a much more challenging treatment experience. So I would like to join the calls of many of the members who spoke this morning and urge the Minister to carefully examine this situation and look at what could be done to remove this bureaucracy which is stopping the advancement in equipment which are so evidently needed. So when we know that every 4 weeks a delay in treatment for cancer patients increases mortality by 10%, the delays, a lack of investment in such a core pillar of cancer treatments are putting lives at risk. The failures to address these issues will leave the 40% of cancer patients who need radiotherapy as a curative treatment, either on its own or in combination with other methods, in a gravely concerning situation. Failure will also have a knock-on effect across all treatment pathways, increasing the pressure on an already stretched cancer services as well as primary care providers. So finally, Ms Davis, I will ask the Minister, will the Minister therefore accept the increased level of support radiotherapy needs to properly fulfil the important role it has to play in overcoming the backlog in cancer treatments? Furthermore, will the Minister commit to a plan to improve both workforce numbers and satisfaction, given the increased pressure that this is having on the provision of services such as radiotherapy? Cancer patients who have suffered so much over the course of the pandemic deserve better than this, and it's about time the government acted. Thank you, Mr Davis.